My name is Dr. Austin Kwan, and today we're going to be talking about some of the main factors of your health that medical doctors are not necessarily well informed about. I just had a patient come in this morning that's one of my friends from college, and we went to one of the best premier kinesiology programs in the nation, and not even once was I told about chiropractic or about the effects of the human body, or the effects of the central nervous system and the spine on your overall health. And we know that on all the research today, there's a lot of things that are influenced by the brain, and virtually every single process in your body is influenced by the brain and the central nervous system. And if we can get that at a more optimally functioning level, whether it's with chiropractic or with other modalities, your brain and your body functions better. And people who have chronic symptoms, chronic illnesses, chronic things that even you've maybe been to a medical doctor for, and the only solutions they might have given you are pills and potions and things, we can make sure that you're getting the most out of your healing process so that you can overcome some of these diseases, some of these conditions that medical doctors struggle to help people with, because some of the medicines are very toxic, and some of the things that other practitioners are trying to do are missing the central nervous system component. So we're going to talk about some of that today. And I'm really fired up to get you guys this information, because there's so many people out there who have this really preconceived notion of chiropractors that we're these back-cracking, voodoo doctors, and there's been a lot of hoopla out there in the space about chiropractic. So I want to kind of clear that up for you all today. We're all about the brain, and we're going to talk about some of the ways the human body is capable of healing itself when it's getting the best information and when it's able to express the most health. So we know, and Harvard Medical School doctors have confirmed and agree with us, that the wisdom of the human body is responsible for the healing that happens in your body. Once, the doctors are all responsible for telling and teaching their patients this, that your body is capable of healing itself. And whether you take a drug or prescription, or even if you get a vaccine, the whole premise of doing that is so that your body utilizes this medicine or this vaccine or whatever it might be, and is trying to produce its own response to it. But if your body isn't if it's not capable of producing that optimal response, you don't get the most out of medication. You don't get the most out of your therapies. So what I'm here today, we're going to make sure that you really understand how important it is that your brain and that your central nervous system is kicking at all speeds, so that you can get the most out of your healing process. There's a super wisdom, and again, this is it's always in favor of life rather than the death. Your body's always trying to adapt you to being able to promote more life and being able to express better health and to adapt to certain scenarios and situations, so that you can live and survive and thrive, right? And that's where we really want to get you, is out of survival mode and back into that thrive mode. We want to really get you to function and vibrate at a higher frequency and a higher level of functioning. And the beauty of this is that it all happened at the beginning, right? One sperm, one egg met and made 37 trillion harmoniously functioning cells that are constantly capable of regenerating, healing, and actually capable of promoting new life, right? And all of the information that you need to heal, and that your body needs to, whether it's killing cancer cells within itself, your body's always constantly killing cancer cells at every second of every day, whether it's being able to digest food properly, if it's able to repair the gut properly, whether it's healing muscle tissue, ligamentous tissue, disc tissue in your spine, all of that information that your body needs for healing is within these two cells. Right? And 2 cells became 4 cells, then became 8 cells, and so on and so forth. And so you have an optimally functioning human body. And we need to make sure that we're tapping into this system. We have to tap into your body's innate ability to heal itself. And that sperm and egg met and made this beautifully functioning, what we call a neurospinal organ. Your brain and your spinal cord are communicating to every cell, organ, and tissue that you have. And this super highway of information needs to be getting back and forth without any interference. And that's what we do, is we have to make sure that we can identify any areas in your spinal cord or in your spine that are being a little interfered with. And there's a word that we use, and we'll use it later, called subluxation. But basically, when there's an interference in this superhighway, it's kind of like if there was a traffic jam on the freeway where, things are going to get blocked up. Things aren't going to flow very well. And pretty soon, if the accident's bad enough, things are going to stop altogether. And the information channels are going to your body's going to have to adapt and go through so many other responses. And we talk about the stress that the spine has. When you have stress on your spine, we know that there's a series of papers published in 1976 that research the fact, and I really practice on the fact. This is a fact that your brain, when there's abnormal movement, when there's misalignment, when there's abnormal function in your spine, it impacts your central nervous system. It impacts your spinal cord. It impacts your brain. It impacts your sympathetic and your parasympathetic nervous systems. And we know that in this superhighway, right, that the spinal cord is going down through the center of your body, and all of these organs are very, very intricate. There's so many small tissues, so many small muscles, ligaments, and proprioceptors, mechanoreceptors, these receptors that are feeding sensory information to your brain constantly, every second of every day, about how you are in space. We need the best information from those sensory receptors, and when there's stress in that process, your body doesn't get the right information. So I give people the analogy that it's kind of like taking a test. If you only had half the material to study for an anatomy exam, and let's just say you're studying the whole body and you only get to study the shoulder, well, if you took the test on the whole body, you're not going to pass. You're only going to get the shoulder questions right. If you only have half of the information or a portion of the information to study, you're only going to get minimal response, and your body's going to have to do a lot of adapting to try to compensate for that. So we need to get your body the best information possible so that you can get the most healing process out of it. And that goes for things pain related, but just overall functioning. Your central nervous system, your brain, is communicating to every cell and organ, tissue, organ system that you have. We have to make sure that all these pathways are clear and connected. Now, the biggest thing that your brain is constantly doing, and you have the autonomic nervous system is the key player here, because these are the things that you don't control. Right? There's been studies to show that your body is getting 3 trillion bytes, right? 3 bytes of information at any given time, but what you consciously perceive is only 50 bytes. So 50 out of 3 trillion, your body isn't, most of what our body is performing at any given second is based on information that we don't consciously perceive, we don't consciously control. Pain is one of those things that we can consciously feel and consciously control, but pain is only part of the equation. It's almost like if you just bought an iPhone and only used the calculator feature on it, right? There's so many other features. There's so much better response that you can get out of your body, but you're only feeding it a portion of the information. You're only getting a little bit of it. Homeostasis is a word we use in chiropractic, which basically means balance, right? In all of your body's systems, but you're constantly teetering between a balance of parasympathetic function and sympathetic function. So sympathetic function is where, let's just say you're getting chased by a snake, or there's a snake in the room, or you're running from a bear, right? There's certain things your body's going to do to put you into a position, your body, and prime your body to get ready to fight, to flee. In that stress response, you're probably not thinking about, your reproductive system. You're not thinking about digesting your meal. Your body is primed to run away, to fight, and to get out of the stressful situation that you're facing. You're constantly in that stress scene. We have to shift you back into parasympathetic dominance, so we can get your parasympathetic nervous system functioning, where your parasympathetic nervous system is more that rest, digest, relax, reproduce, and all the hormones that are associated with that need to be functioning at a high level so that it can balance out the amount of stress that we have. And especially in today's culture, we have so many different stressors that have never been experienced in the history of mankind. The number one thing that we see at our office is cell phones, right? There's never been a population in the history of mankind that's constantly been looking down at a cell phone for multiple hours out of the day. And when you're constantly putting your body into this stressful physiology, not just by the content that's on your cell phone, but structurally putting your body into a flex stress position, we need to be able to take you out of that and get your body, again, to shift towards that parasympathetic balance. So, super important. Now, stress tone is very important, though, in our body. If you did have a snake in the room, it's very important. Or if you're running from a bear in the woods, it is very important that your body is primed. So things like your lungs being able to breathe faster, your heart rate being able to increase to pump more blood to the periphery, your bowels are going to slow down, your blood vessels are going to constrict and make sure that your blood pressure is increased so that you can get more circulation, right? But this is good in spurts, right? At times, this is an excellent thing. But when this becomes a dominant factor in your life and you constantly are subject to this stress tone, we know that stress hormones are indicated in virtually every chronic disease that exists. So if your stress hormones, if we can't remove what's causing your increased stress tone, you're going to continue to contribute to your chronic disease, your chronic illness. And it's an epidemic in America right now. We have 50 million Americans that have a diagnosed autoimmune condition. We have, and there were virtually no autoimmune condition, years ago. There's cancer is rampant, right? Your body's ability, because of stress, your body's ability to adapt has really significantly lowered. So we need to do everything possible, not just with chiropractic and with other types of therapies, but we have to do everything possible, whether it's meditation, putting your brain and taking you out of stress tone to get you to balance the system out. But the fight or flight response is an essential need. We have to make sure that it's balanced, right? But the beauty of what the parasympathetic nervous system does to balance this out is a lot of it's connected and it's all sensory information, right? This is an image of your vagus nerve. And the vagus nerve is one nerve, one single nerve that exits the base of your skull, and it goes all the way into your abdomen, your thorax, and your pelvis, and it touches virtually every organ there. And we're going to go over some of these symptoms, or some of these features of the vagus nerve. We know that the ganglions start at the very top, right at the base of your skull, and it virtually touches everything from your pharynx, your larynx, your lungs, your gallbladder, spleen, pancreas. Heart is the biggest one, and it's what we use to measure how your vagus nerve is functioning, is something called heart rate variability, where it measures the beats in between or measures the distance between beats in your heart rate, and can kind of tell how much influence your parasympathetic nervous system, your vagus nerve, is exerting onto your heart at any given time. And it's been a time-honored indicator of how your parasympathetic balance is. And the more that we can do to boost the vagus nerve function, we know that you're going to experience better healing results. They've done studies in the Journal of Oncology recently in 2018 about cancer prognosis and the vagus nerve. When you have a high vagal function, when your vagus nerve is at an optimal function, we virtually can't, like, cancer prognosis goes way up, but it's all about your vagus nerve. Your body's ability to heal and your body's ability to recover from cancer even is very, very indicated with how your parasympathetic nervous system is functioning overall. And now when we talk about functions of this vagus nerve, you can talk about virtually all the organs, right? So you're talking about brain, mouth, tongue, eyes, skin, gut, heart, pancreas, liver, gallbladder. All of these different functions are essential functions that your body is doing every single day. These are happening all the time. And what's happening is when they start to become dysfunctional, that's when we start to see symptoms. So when these collection of functions start to diminish, or when you start to get lower functioning out of your vagus nerve, and these functions don't work as well, and chronically don't work as well, now you start to develop symptoms of vagus nerve dysfunction. And how many drugs, how many pills, how many therapies are targeting certain issues here that are simply, or that are very much contributed to by a dysfunctional parasympathetic nervous system. So your nervous system is communicating all this information from your gut, from your brain, all in your organs, to your brain to tell it how it needs to adapt, what hormones to release, when the immune system needs to kick in. And when that process becomes dysfunctional, issues start to arise in the body. And you're talking about some really serious issues here, from heart failure to poor immune function, chronic fatigue, chronic inflammation. Obesity is rampant here in America. Depression, anxiety disorders is something that I'm very passionate about, because we see a lot of kids, and a lot of my generation really struggles with anxiousness and depressedness. And part of what our physiology is dictating is this repressed physiology, when your head is down, when you're kind of in this small, sulked posture all the time. So we really wanted to get this, we got to make sure that people's vagus nerves are functioning at an optimal level. And if you've never had yours checked, if you've never had any information about if your parasympathetic nervous system is functioning well, it would behoove us to make sure, the same way you would get your teeth checked every year at least, or at least, you guys we're supposed to. We want to make sure that, people understand about how important their nervous system is to get checked. Now, that your Your brain and your body are so intimately connected. And when you start to affect the brain and you start to affect the nervous system, things start to change. And the chiropractic is just one way to affect the nervous system. There's so many other ways, but and one of my mentors, Dan Sullivan, talks about this, but he talks about that if chiropractic disappeared off the face of the earth tomorrow, right, the brain and the spinal cord, the relationship between the brain and the spinal cord and the spine still exists. And we have to make sure that we can do anything. If it's not chiropractic, we have to be doing something to eliminate the stress on your nervous system. And what Heidi's research has done is really implicated how important it is that the chiropractic adjustment becomes a part of healthcare because of what it's doing to the brain and how chiropractic adjustments to specific areas, even in your spine, whether it's upper cervical, lower lumbar, or anywhere in the thoracic spine, these different areas that you adjust very specifically can change how we affect the nervous system and what parts of the nervous system we affect. So really, really cool research. Heidi is an excellent, I highly recommend this book, The Reality Check. But we know that without a doubt, and chiropractic research has shown that if you have a subluxated spine, and this isn't like, bone out of place or things that are this isn't a medical subluxation term. We're talking about subluxation in the idea of an energy flow, where your brain is constantly sending these electrical circuits up and down, right? Your brain is electricity. The nerve flow that you have nerve conduction is based on electricity. When you have low functioning, dim functioning in your body, it's almost like you have a dim light bulb. Eventually, you keep turning the power down and lower and lower and lower, and pretty soon it's all the way out, and your body stops functioning. It fails, and it starts giving out, and now you start producing really bad symptoms. So what our job is to do is we need to remove this subluxation. We have to turn your power back up, and that's the term that we kind of throw around in chiropractic, but we really have to make sure your brain is getting the most information, the best energy flow up the spine into the brain so that it can send it back out, and we can get the best adaptive responses. And you can kind of see, we want you to be over here. We don't want you to be in a dim functioning. We want you at a bright, beautiful, vibrant functioning. And this is one of the reasons. The first subluxation for many babies starts at birth. And the reason is because the normal birthing process can put 60 to 90 pounds of pressure on a baby's upper cervical spine. And whether it's torqued or twisted, and the biggest thing right now is C-section births are going through the roof, so it's virtually impossible to get a baby out of the womb without pulling on their neck. And you're talking about a baby's neck that's not even real bones yet, it's cartilage, and it's very, 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 very fragile. So when we're tugging, if God forbid you get a forceps birth or a vacuum extraction, these different types of stressors on a baby's neck go undetected and go unchecked most of the time. So what we do is we check babies at my office. I see a lot of newborns, a lot of moms bring their baby right after the hospital to make sure that we can check them so that their brain, especially when the nervous system is the fastest developing when you're an infant, when we can check you and when we get that baby checked, the body is able to production of development, especially in a young baby. So another reason why, again, the reason why these structures are so intimately connected is because there's very small muscles here at the very base of your skull, in the upper cervical spine, that when these muscles are damaged, when there's microtrauma, when there's different types of forces that go into the upper cervical spine here, it's going to change your body's adaptive process. It's going to change how your head sits on your body. A lot of babies deal with torticollis, a lot of types of upper cervical issues. Some chiropractors only focus on this area because of how intimately connected this is with all of your physiology. And we know the vagus nerve comes out right about here, right? The nodus ganglion is right here, the transverse process of the atlas. So when there's pressure on that system at the base of your skull, there is a plethora of different nervous system adaptations that are going to occur. Most of them are going to be poor. And we know that, think about all of societies in the history of mankind, right? Every society has always known the importance of this upper neck area, right? And you don't see anybody, executing people by cutting off their feet or cutting off their toes or anything, right? All of when the people get executed, it's all about here at the neck, right? And you're talking about whether it's a noose or whether it's a guillotine or whether it's a samurai hacking your head off with a sword. All of it happens right here at the base of your skull. So it's so critical that we're able to get, if a really severe trauma even if it's just a broken bone here at your atlas, if that could kill you and it could do that type of damage to your body, and it could even paralyze you in Christopher Reeve's case where it paralyzes him and his body degenerates 40 years in 5 years span, if that can happen with one trauma, what does micro trauma do? What do these small traumas? Does a small trauma do nothing then? We need to make sure that we're getting this moving and that we can make change to the upper cervical spine because of how powerful this area is. And again, it's all focused up here at the top of the neck. The power of the adjustment is beautiful because when you have subluxation, when you have misalignment of the spine, when you have decreased motion in your spine, like we said and we talked about earlier, there is going to be impact on your central nervous system. And when it goes, there's all kinds of neuroscientific pathways where your spine is sending different information of different columns in your spinal cord. But one of the big ones is it comes in here through the spinal cord and it comes out to the sympathetic chain ganglion. And this is a reflex arc right here. So it doesn't even go up to your brain. We're talking about just the way that your spinal cord sends information back out to the body. It can affect all of the organs here, your blood pressure, your immune system, right? Most of you feel pain and disc pain. But really, we're talking about the whole body that's just implicated here in the spinal cord. And then we start talking about pathways that go up into your cerebellum, ultimately to your vestibular nucleus, which goes out to your nucleus solitarius tract. And then ultimately that gets sent out to your GI tract, your heart, lungs, and your digestive organs, right? All of these things and things that are going to promote immunity in your body. So your body is communicating constantly through these pathways. And if there's subluxation, if there's misalignment in your spine, this is going to cause an increased stress response. And all of this in your brain is not going to be functioning at an optimal level. And the more adaptation, the more compensation your body has to go through, right? Your brain is beautiful. It's very neuroplastic. It's able to adapt. It's able to change. But we want to give it the best information so it makes the best decision, so it makes the best change in your body. And the beauty of chiropractic now is there's been more research in chiropractic and on the spinal adjustment than ever before. And there's a great study that came out in 2011, Agura. He had a really nice PET scan machine, right? $3 million PET scan machine. And they tested what one spinal adjustment does to the brain. And they found that, and we talked about the sympathetic nervous system, right? We talked about how when you have stress, when you have increased stress hormones, that your body is going to contribute, increased stress hormones are going to contribute to your body's chronic illness and chronic disease. This study showed that after the adjustment, it inhibited the sympathetic nervous system. So when we can decrease your sympathetic nervous system tone with an adjustment, even if it's just one adjustment, your body is going to significantly heal. It's going to be able to shift that balance back towards rest, recovery, digestion, proper absorption, hormonal balance. Right? It's very, very important that we get this out. Improved heart rate and breathing, ATP production. I was an athlete my entire life. ATP production is your body's ability to produce energy. If we can get better energy out of our athletes, out of just our everyday human being that's functioning in the corporate world, you could think of what the potential for humankind could be if everybody was getting adjusted. Right now, 4% of America sees a chiropractor. If we could boost that even to 8%, there wouldn't be enough chiropractors to take care of everybody. It's so critical that we can get people to understand how important their nervous system is for overall functioning. And again, it changes the way your brain's utilizing energy. So it's beautiful what the brain does when you get a spinal adjustment. When your body's in a stress tone influences immunosuppression. So it's going to suppress your immune system. We talked about, right? Your body, if a bear is chasing you in the woods, you're not focused on fighting off the flu or you're not fighting off a cold, right? Your body is going to be completely focused on the stress. So we need to make sure that we start affecting the stress tone. And when you can get adjusted and reduce that stress tone, it increases the function of your parasympathetic nervous system and it allows us to boost the immune system. And that's the beauty of what we're doing here. It's not just back pain. Back pain, neck pain, frozen shoulder, headaches, that's great. We love to take care of you and we're really good at it. But that said, we need to, account for all of the other factors that chiropractic and the spinal adjustment is powerful in changing in your brain and in your overall health. And especially when it comes to the immune system, you talk about, the flu shot this year and in the past years has been less than 10% effective. And we continue to push that people want to get the flu shot. The flu shot's had a lot of really bad side effects this year. People are getting encephalopathy. They're getting polio-like disorders. There was a senator recently that supposedly got the flu shot and died. So there's deaths happening. People's lives are at stake because their immune system is compromised, and people are trying to get ways so that your body is boosted and so that you can fight off infection better, but they're missing the most important component, and that's your nervous system's input on all of these processes. If you can only get a certain amount of information about how to fight off the flu, we have to boost your brain's ability to get better information, and then you can fight it off better. And we argue here at our office that you don't need that. You don't need that. A lot of people here, the first thing that they tell us after they start seeing chiropractic care is that they don't get sick anymore. They don't have these types of old lingering coughs or stomach or sinus infections and things like that. So it's really, really cool stuff. But it's because directly when we affect the parasympathetic nervous system, it boosts your immune function. We call them you get your flu adjustments, right? Now, the beauty of what we're also doing here with chiropractic is when you activate areas in your prefrontal cortex, and this is some new research from the journal Neuroplasticity 2016, and they showed that when you get adjusted, it changes the way your prefrontal cortex functions. And this is huge in today's society. The prefrontal cortex is very, very intimate in behavior, decision-making, memory and attention, intelligence as measured on IQ scores, autonomic function overall, motor control, processing of pain and the emotional response to it is huge right now, whether you're PT, whether you're acupuncturist, massage therapist, all these hands-on manual therapy practitioners have all talked about the psychosocial component of pain. But if we can change your brain, not just by teaching people that their back pain isn't as significant as it is, or that their pain is not supposed to inhibit them from living, or that pain is normal and all this stuff, that's great. But if we can change the way that your prefrontal cortex actually functions because of the structure that we change, that's the moneymaker there. So we need to make sure that people understand this, whether you're a PT, whether you're a massage therapist, acupuncturist, a medical doctor, a naturopathic doctor, or just even an average health coach, or somebody who's really promoting their stuff on Instagram or whatever it might be. We want everybody to understand how important the prefrontal cortex is, but just the power of the adjustment to change the things that are functioning in the prefrontal cortex. So again, really cool research, and more stuff is coming out every single day. So I encourage you guys to continue to look at some of the stuff. The chiropractic adjustment cannot be replaced. So when you have, there's no drug, there's no exercise that you can be given, there's no therapy, there's no thing that we can hook you up to, there's no vaccine, there's no drugs that are going to remove the subluxation, the interference from your spine that's inhibiting your central system from getting the best information. To this day, that first adjustment that I got was the most profound experience that I probably ever experienced in my life, where I genuinely wondered the entire drive home from my adjustment, how do people live? How do people live subluxated? How do people live at this dim functioning? And one adjustment changed my life. So it's my mission to make sure that everybody can experience this, and you have to at least hear the message. And I would encourage you all to, if you can't come see me here in Newport Beach, you got to go find a chiropractor that's going to address and correct your subluxation. And if we can change if we can change this in the world, if we can change how chiropractors are perceived because of the BS that people have been saying about chiropractors for such a long time, I think we can really make some change to the world, and especially in a world where there are 307 mass shootings here in America. People are on drugs. There's 7 million kids on psychotropic drugs just in this past year. We need to make change for our generations to come. And as a young doctor, that's where I really can hit we hit home runs with kids and with young people, making sure that they vibrate at a higher level and that they get the most out of their lives, and that they're not bound, they're not reliant, they're not a slave. They're not slaves to the medical profession and being on drugs. Because once you start taking Adderall and Vyvanse and Concerta and all these, they're derivatives of meth and methamphetamines, right? So when people are taking these drugs and people are taking antidepressants and antipsychotic medication, the side effects of those are suicide and homicide. And it just makes sense why people start to feel like this is because people are getting their brain chemistry changed by drugs. We need to get back to using natural remedies, and if a collection of adjustments can change that for people, that's what we want to be doing rather than taking more drugs, right? And what it takes is planting a seed. I've compared to any, I don't know if you guys have grown anything in your lives, but when you plant a seed, the tree doesn't grow overnight, right? You don't have a beautiful producing apple tree when you plant the seed yesterday. It takes time. Healing takes time in the body. If you broke your arm tomorrow, there's only so much you can do to speed up how fast your bone fracture is going to heal, right? Even an orthopedic would agree with that. All medical, anybody would agree that your bone is going to take some time to heal. Your body takes time to produce healing. And we have to plant the seed today. Sometimes you got to nurture it. You got to talk nice to it. You got to water it. You got to put good nutrition in the soil. You got to do things to promote better health. And eventually you get your beautiful, healthy tree that's very resilient to stress. When this tree gets rained on, it gets snowed on, it's very resilient to stress. It's deeply rooted. It has a firm foundation. And you're able to become more resilient to stress. So that's what I would encourage you all to do today, is to find the things in your life that are nourishing you and that are able to, that your body is able to get the maximum vibratory frequencies out of, and that you continue to push towards that, and that we continue to heal the body using these natural remedies rather than kind of continue to dim ourselves down with poor posture, drugs, surgeries, and other things that, obviously medicine is very important in an emergency situation, right? If you break your leg or if you get shot, don't come to the chiropractor. There's only, I can't do anything for you if you have a gunshot wound. If you have a heart attack, there's certain drugs that are going to help you in that emergency situation. But, we give the analogy that if your house was on fire today, you call the fire department, and the fire department comes and they use their big hoses and their axes and all this stuff, and they break down your house and they put the fire out. But when you need to rebuild your house the next day, do you call the fire department to come back and build your house? No. You have to call a contractor. You have to call a plumber. You have to call all these different people. The medical profession's tools are for emergencies. The drugs are for emergency situations. But we can't treat every situation where you have a little cold or if you have a little, a stubbed toe. Vicodin is not the answer. And unfortunately, a lot of that's the situation, is that the medication is being prescribed in non-emergent situations, and we need to get away from that. That's why we have the sickest population in the world right now. So what I'm offering today for everybody watching on Instagram, anybody who sees this video today, I'm really passionate. I want to see your scan. I want to see how your nervous system is functioning, because most people have never seen how their nervous system is functioning. And a heart rate variability scan has been scientifically proven to be a great indicator of how your vagus nerve is functioning, how your parasympathetic nervous system is balanced with your sympathetic nervous system. And if you're in more stress tone, we have to get you out of that. And we're going to do everything possible. We do a lot of different things here at my office to make sure that we can get you out of that tone and boost up your overall functioning. But it's all dependent on how your body is and the different circumstances that you're in. So if you're anywhere near California or in the Orange County area, come by my office. I would love to have you for a free scan. Just call my office. We'll get you scheduled for an appointment. Or send me a DM on Instagram. I would love to have you guys here at the office. It'd be my honor to take care of you and to serve you. But it really starts with you getting checked. We have to make sure that we can identify the stressors in your life and what's going on that's causing you this stress tone. And we need to start removing those stressors. And when subluxation comes in a chemical form, in a physical form, a physical structural form, and even an emotional form. So when we can start removing some of these factors that are continuing to stress you out, and again, contribute to your chronic disease, chronic pain, and chronic illnesses, when we can start removing those, your body is going to get the best information from your tissues and from your sensory system so that you can promote the best healing in your body. And again, it's all about above, down, inside out. We have to get your body to heal from the inside out with those original DNA strands that your body was able to produce at the very beginning, that innate force and that innate capability for healing that exists in all of us. We need to make sure that everybody has an opportunity to express that. And that's my mission to you. This is Dr. Kwan signing off.